For our final project, we chose rehabilitation. Our mission is to provide unprecedented levels of genuine care and help patients achieve their highest level of recovery while utilizing resources such as our interdisciplinary team to maximize the quality of human life. The employees of our rehabilitation center are committed to fulfilling patients' and families' needs and play a vital role in patients' roads to recovery by helping to restore optimal physical, cognitive, and emotional function. Through a holistic approach to quality care, we value patient-centered care, foster human dignity, and are dedicated to excellence. The integral element of this process is the compassionate professionals working side by side with patients to set goals and achieve milestones in their journey, one step at a time. All services offered are intended to contribute to the patient's and family's physical, social, spiritual, and psychological well-being while maintaining a supportive environment.
Hello everyone, my name is Ashley, and I will be talking about one of the nursing theories applied to the rehabilitation setting. Mine is the goal attainment theory, and Marissa's will talk about the trans-theoretical theory. So goal attainment theory. So what this is a relationship-based nursing theory that is founded on the mutual perceptions of both nurses and patients. Goal attainment theory facilitates patient-centered care. It involves identifying a problem through actions, interactions, mutual goal settings, and looking for ways to achieve the goal. Goal attainment theory and its basic elements. According to, I'm not going to even try to pronounce their names, but 2018, goal attainment theory is based on 4 basic elements. So health is attained through appropriate nurse-patient relationship. Nurse and the patient need to have a mutual understanding about each other. The goals and function of the nurse and patient need to be in line with each other. The nurse needs to use all of their knowledge to set their relationship and goals. And these 4 basic elements are crucial in attaining a goal. So goal attainment theory in rehabilitation centers. So goal attainment theory helps in quantifying progress on personal goals in a rehabilitation center. Nurses can utilize this theory to set goals and make decisions on the means to achieve these goals for their patients. The theory encourages assessment through nurse-patient interactions. Nurses utilize their skills and knowledge, while patients provide knowledge and perception of problems of concerns during interaction. Therefore, this theory aids in the rehabilitation process, as it facilitates sharing of knowledge and setting of goals between nurses and patients during the recovery process. It helps to achieve the highest quality of life possible during rehabilitation by enabling patients to achieve certain milestones gradually.
Hi everyone, my name is Marissa. I'm going to be talking about the trans-theoretical theory, which we talked about in class. So basically this was a theory developed by James O. Prochaska and Carlo Di Clemente. And basically they made this model, and it goes over 5 stages, which we will be talking about shortly, and it helps people change. It's a model of change. It's not typically defined as a theory, but like I said, it's more of a model used in the nursing profession. And it says right here on the slide, defined not as a theory, but a model used that targets behavioral change. So we might see this in, as what we're talking about rehab centers, anyone that's really trying to make a change in their health to promote, the best possible health that will benefit them in the future. So yeah, we'll go on to the next slide. Okay, so this basically tells all the 5 stages. There is technically a sixth stage I've seen, but we didn't put it in this slide because it's not commonly used. So these are the 5 stages of this theory. So we have the pre-contemplation, the contemplation, the preparation, the action, and the maintenance stage. So I'm just going to go through each one of these. So the pre-contemplation stage is basically the person is kind of in denial. They don't want to change. They think they're fine. They might think people are kind of overreacting. For example, if someone was addicted to alcohol, right? They might think, oh, like, I'm fine. These people are thinking too much into it. So the contemplation stage, which is basically a stage where the person starts thinking about that change, and they're kind of, looking at the benefits and the risks, and they're kind of just like the ideas in their head to change. And the preparation stage is like the real meat and potatoes of the stage, just because they're at this point actually looking into starting this change. You might see them looking into researching this change, kind of like the contemplation, but more involved. You might have them going on articles and finding places that will help them change, like a rehabilitation center. And then, as the next stage implies, action is when they actually take action and put forth this change by trying to become abstinent from what they're trying, like if someone is an alcoholic, they might try to become abstinent from drinking the alcohol. But this could also be anything regarding health. So, for example, diet. They might start cutting out these really unhealthy foods that will benefit them in the future to benefit their health. And maintenance, as it implies, is maintaining that what they've done these past few stages, maintaining that healthy lifestyle that they've worked so hard to get to. And like I said, there was a sixth stage that is kind of seen and not seen sometimes. It's the termination stage, where this act or this thing is completely determined, where you have no thoughts of going back. But it's generally seen as mostly the maintenance stage for most people that undergo with this model. So for this slide, I actually found 2 examples of this theory in action with medication adherence and weight loss. So with the medication adherence, I found an article called The Use of the Trans-Theoretical Model in Medication Adherence, a Systemic Review. And it talks about interventions for medical adherence for people with chronic healthcare conditions. So this could be someone with a, CHF, some sort of heart failure. And it helps them improve their adherence to the medications they're taking. We all know that some patients might not want to stick with their medication routines, whether it be like diuretics or something. And they might use this model to kind of see where they're at or how they think about these medications and see how they can improve their idea of taking them. And they actually found that this model really helped at patient adherence to those treatments. That's one example. And then the next article I found was the trans-theoretical model is an effective weight management intervention as randomized by a controlled trial. So I talked about this a few slides ago, and basically it's the same. They used the trans-theoretical model to see what stage they were at in their weight loss. So, this could be denial, it can be they're pre-contemplating, and what have you. And they actually found that using this model helped with a better outcome as opposed to the group that did not have them. And both groups were used, both groups that were used in this experiment basically were given the same exact type of treatment, as it'd be the same time exercising, the same diet. They actually found that the group that used the trans-theoretical model was a lot more efficient in losing weight. That was another example. All right, so basically this is what we're talking about in the presentation that we're doing right now, which is the rehab center. And this can be many different types of rehab. But for example, what we're doing right now, or like what I put on the slide, would be basically with alcohol rehabilitation. So people who have dependency issues with alcohol. And I actually found an article at the bottom here that actually did a study with a man who was drinking 1,500 to 200 milliliters of alcohol every day. And they started using this trans-theoretical model with him beginning at the pre-contemplation stage. And it actually found that it was very, very effective. And he actually made it all the way to the maintenance stage. So in this instance, for example, let's go over, we'll go back to the model that we were using before. So this man started in the pre-contemplation stage. He did not want to quit. He probably, was in denial, and then he made it to the contemplation stage. So this could be the thought that, maybe this alcohol thing isn't great. Maybe it is affecting me in my life. This preparation stage, he might have went on to, or which he did go on to, would be where he's actually seeking out this rehab, or seeking out, making change. And then that action would be him actively seeking treatment at this rehabilitation center, to get help and to actually become abstinent from alcohol. And then he made it to the maintenance stage where he was maintaining that. And the nurse may use this model, in any instance, basically, to determine where this person's at with how they're going to begin their treatment. So if someone's at the contemplation stage, we can accommodate for them at that stage. If they're already at the preparation stage, we can kind of make this treatment go a little faster. It's all dependent on what stage they're on. And which I really like this model. It's because it kind of gives you an idea of where you can start your treatment and how you can go about it. So yeah, that is basically my part of it, and I'll hand it on to Melanie.
Hi, this is Melanie, and I'll be discussing services and activities within the rehabilitation setting. Rehabilitation medicine uses many kinds of therapies and devices to improve function. The type of rehabilitation a person receives depends on the condition causing impairment, the bodily function that is affected, and the severity of the impairment. Some common types of rehabilitation and services include cognitive rehabilitation therapy, which involves relearning or improving skills such as thinking, learning, memory, planning, and decision-making that may have been lost or affected by brain injury. Occupational therapy helps a person carry out daily life tasks and activities in the home, workplace, and community. Physical therapy involves activity and exercises to improve the body's movement, sensations, strength, and balance. Recreational therapy helps improve symptoms and social and emotional well-being through arts and crafts, games, relaxation training, and animal-assisted therapy. Speech and language therapy aims to improve impaired swallowing and movement of the mouth and tongue, as well as difficulties with the voice, language, and talking. Rehabilitative assistive technology refers to tools, equipment, and products that help people with disabilities move and function. Rehabilitative technology includes orthotics, prosthetics, wheelchairs, alternative communication devices, and hearing aids. Some other rehabilitation services include vocational rehabilitation, which aids in building skills for going to school or working at a job, music or art therapy, which can specifically aid in helping people express emotion in cognitive development or in helping in people with social connectedness. These services are provided by a number of different healthcare providers and specialists, including nurses, physicians, occupational therapists, physical therapists, cognitive rehabilitation specialists, rehabilitation technologists, and speech therapists. In the rehabilitation setting, the top left picture is for physical and occupational therapy to help strengthen the body and carry out daily tasks. The top right is a pool for recreational activities. The bottom left is a nurse's station or a meeting place for the interdisciplinary team. And the bottom right is the patient's room. The room has a homey feel, unlike a hospital room. It has amenities to promote independence with ADLs, and is spacious to allow any equipment that may be needed to be brought into the room.